recognize so many faces here today. It's great to see you all. I know that many of you are familiar with Nursing Now, and perhaps we've been in one of these rooms together before. If you've heard me talk about the Nursing Now Challenge, then you already know that I'm going to tell you that this is the one group within the nursing profession that has the power to change the entire trajectory of your career. That is true. The Nursing Now Network holds opportunities strong enough to impact the 29 million nurses around the world within our profession. But if there is one single opportunity within this network that you need to be a part of, I promise you it is this initiative. I applied for one of these global solutions initiatives too back in 2021, and coincidentally, it was also one to influence vaccine uptake, acceptance, and health equity with the Sabin Vaccine Institute. After winning this initiative, I was able to influence my community in New York City and bring my advocacy skills from the bedside to the United Nations General Assembly, to the World Health Assembly, and just to all these different spaces where nurses speaking beforehand was something unrecognizable. I was connected with nurses like Harriet, who you'll hear from today, who showed me that the investment in a nurse is worth more than any of the 180 currencies that we use throughout the world. She founded an entire school for girls, influencing health promotion and sexual reproductive health throughout Uganda. And I was never one to believe that individuals came from the power came from the fancy individuals sitting up in fancy White Houses in Washington, D.C., until I saw Lafayette, who's also going to be joining us today as a speaker at the White House event, as a result of her participation in a challenge with Nursing Now and the Sabin Vaccine Institute. Currently, there are nearly 660,000 new cases of HPV per year and 350,000 cervical deaths per year. Excuse me. By participating in this initiative, you will not only have the power to impact someone's life, you will have the power, capability, and influence to impact 660,000 lives. You will have the voice to impact entire communities like Harriet's and Lafayette's. And you will have the platform to show the world the infinite potential that one nurse can have. If there were ever an initiative within Nursing Now that you need to be involved in, it is definitely this one. And with that, we're going to hear a message from our amazing Aisha Holloway, who could not be with us today, but we're going to try to share a short message with her, with you guys from her.
We seem to have a problem. Can you all see my screen?
We can. It just says a network error has occurred.
Okay.
So if you'd like us to loop back later, we can definitely try.
Let's do that.
Yeah, no problem. It was a full moon here in the United States, probably where you guys are as well. So just some technical difficulties today. But we do have another exciting thing on our agenda that we'll move on to. I'm going to hand it over to the amazing Global HPV Consortium team. And they are going to tell you all about this incredible initiative.
So actually, I think before we get to the initiative, I think Dr. Aramoke is going to give just a brief overview of what HPV, human papillomavirus, is and how that can lead to cervical cancer. So over to Dr. Aramoke.
Thank you. Thank you so much, everyone. Can I share my screen?
Yes, absolutely.
Okay. So I'm just going to do that. Can you see my screen?
Yes, we can see your screen.
So thank you, everyone. Is that a good one? All right. Thank you, everyone. Good afternoon again, and thank you, everyone, for being on this call. And my name is Aramoke Sojo Udutayo, and as I said earlier, I'm a faculty officer at Babcock University here in Nigeria. So it's my utmost pleasure to be the one setting the scene for the launch session of the Nursing Now Challenge Global Solution Initiative and the HPV Consortium by way of introducing to you what cervical cancer is and the HPV vaccine. So what I'll be doing really is just to speak a little about cervical cancer and HPV. So what is cervical cancer? Cervical cancer has been said globally to be ranked number 4 of the most common cancers amongst women, and it's the leading cause of cancer and cancer deaths. So with a global estimate of 625,600 linked HPV-linked cancers. So it's really a public health concern with about 660 new cases and 350 deaths recorded in 2022. So cervical cancer is a big issue. It is the highest prevalence of cervical cancer has been recorded in the sub-Saharan African, followed by the Latin America and Caribbean, with the Eastern Europe and South Asia sharing similar prevalence. Okay, so of the 350 deaths that I mentioned earlier, 94% was said to have occurred in low and middle income countries. And that's huge. And the main cause of this has been linked to the high risk type of HPV. So the HPV, the high risk type of the HPV has been said to be linked to 99% of cervical cancer. So cervical cancer, HPV does not cause only cervical cancer. It also causes cancers in the vagina, the vulva, the penis, and oral cavity. So let's take a quick look at what a healthy cervix is. So that's a picture of the cervix. The cervix is a very important reproductive part of the female reproductive system. It is the lower part of the uterus, as you can see there, and it connects the uterus to the vagina. So it's also called the entrance of the womb, or now the uterus, okay? So it's roughly about 2 centimeters and it sits just at the end of the vagina. So the circular view you can see on your right-hand side looks like a donut. It has a tiny opening, and that opening is called the os. And that's where it can contract to as much as 10 centimeters during delivery. And that os is also called the entrance or the gate of the cervix. That's what a healthy cervix looks like. So now let's go to the cervical cancer. So you can see a healthy cervix, what it looks like on your left, and the one that is infected. So cervical cancer occurs when cancer cells slowly and progressively grow in the cervix, okay? So these abnormal cells, they kind of multiply as they grow, and where these cells grow determines what it is called. So the cells, depending on the location of their growth. So describing the cervix, the epithelial layer of the cervix is where these abnormal cells grow. And because it is the epithelial area, it is called squamous carcinoma. There are 2 types. So the squamous carcinoma is what it is when it grows on the epithelial area of the cervix. And this growth, 99% of these have been associated with the human papilloma virus. So, and these cells, when they are growing, depending on intervention, at this stage, they can be precancerous, not causing so much damage if it's intervened, and causing dysplasia. But as it progresses and when there is no intervention, it becomes cancerous. All right, so it can become cancerous, and because this phenomenon is slow and steady, the person is asymptomatic, doesn't have any symptoms. But as it progresses, there are early symptoms, and these symptoms include vaginal bleeding. But as it even advances to the later stage, the symptoms include watery vaginal discharge. There's difficulty in urinating because of the blockage, and eventually there could be weight loss. Okay, so and this the cervical cancer can be diagnosed with pap smear or pelvic examination. So what causes cervical cancer? That's a picture of the HPV cells. So the kind of HPV cell that causes cervical cancer is called the high risk. That means we have the low risk HPV strains. So the high risk HPV strain is what causes cervical cancer. So the changes in the DNA of the cervix that makes the skin cells of the cervix to multiply and invade healthy tissue is this high risk HPV. And it's a virus that is commonly sexually transmitted. And there are about 200 different types of the HPV. And 40 of these have been associated with sexual transmission. So the different types of HPV infect different parts of the body, like I said earlier. So the category of the parts that the HPV can infect have been categorized into skin, the skin area, the oral cavity, or the anogenital area. So because I explained that the HPV infects the epithelia of the cervical cell, of the cervical area, so it is called the cervical, it's called the epithelial cells that is this HPV infects. But there are many strains of this HPV, but the one that is causing cervical cancer is called the HPV 16 and HPV 18. These two, they are categorized as high risk human papillomavirus. What are the different risk factors of contracting this infection or this disease or getting or acquiring cervical cancer? So it has been said, research has shown that tobacco smoking can put a person at risk. Multiparity, when women have many children, they can be at risk of having cervical cancer. Early onset of sexual activity can make a lady eventually have cervical cancer. The history of multiple or different other sexually transmitted infections. In cases of immunosuppression, maybe, for example, HIV, when somebody's immunity is suppressed, they can be prone to it. And one last thing I've mentioned there is lack of regular screening. So when a woman is not exposed to frequent screening to check, especially from age 35 and above, where you check and examine if there is any abnormal growth, somebody might become, because it is asymptomatic, a person can come down to having cervical cancer. However, because it's a public health and global health issue, the WHO is taking a huge step to eliminate cervical cancer with this target. So there's a target called the 90-70 target, which is to vaccinate and screen women by 2030. So they have a target to vaccinate schoolgirls age 9 to 13, 90% of schoolgirls age 9 to 13 by the year 2030. And that is one of the things when I came to Nigeria, the way it was kind of getting implemented. And I'll be sharing my experience of that implementation when I came home. And another target there is to screen women of reproductive age, about 70%. I hope we can achieve that, and treat 90% of women with this cervical cancer disease. So these are the benefits that we hope to achieve by 2120. So the WHO is hoping to reduce the incidence of cervical cancer by 42% in 2040 and by 97% by 2120. That's a huge one. But in summary, HPV is the leading cause of cervical cancer, and I'm happy that we're championing this call. Is the leading cause of cervical cancer and cancer deaths among women, and it's sexually transmitted. And women in low resource communities and countries are most at risk. So immigrants in the West, low resource countries around low and middle income countries are at risk. And this is because most of the time they do not have access to screening, and if the acceptance of vaccination can also, or even availability of vaccine can also be constrained. So early screening has shown to offer to help with early diagnosis and prompt treatment, like I said earlier. So if a lady is, or if a woman is screened as early on, she's able to get treatment as quick as possible before it becomes cancerous. And vaccination has proven to offer all women protection. So I think that health equality that includes availability of screening across all category of people, all countries, all people, and acceptance of the use of vaccine by the people can help us to avoid and manage cancer. So I think avoidance and management of cervical cancer is very possible. So thank you so much for listening.
Thank you so much for that amazing explanation and for inspiring us and showing us like the true purpose of this initiative. It really is amazing. We're gonna move on and try to play our video. Faye is gonna try to share our message from Aisha, and then we'll pass it over to Marissa to explain more about the challenge.
So can anyone else hear anything? I can't.
No volume, no volume.
Oh my gosh, that's so frustrating. I thought because I had unplugged everything, it should work. Put this one on, put this one on full. I'll try again. I apologize. No, still no good. I'm
That's so
so
strange.
sorry.
It started off with volume and then there was nothing. I wonder if you share the link with Amy. Amy might try and
Yeah, I can definitely try.
we'll just keep trying. Marissa, let's go to you now, and then we'll try again in a minute. Sorry, everyone.
That sounds great. When you do go to share the screen for the video, when you click the share screen button, if you click share sound in the bottom left-hand corner, that might work as well. But I will go ahead here and share my screen. I'm so pleased to be here today and joining hands with the Nursing Now Challenge to co-host this Global Solutions Initiative series on HPV and cervical cancer. My name is Marissa Malchione, and I work with the Sabin Vaccine Institute. I am part of our HPV initiative and lead for our Global HPV Consortium, which I will talk a little bit about now. So Sabin is home to the Global HPV Consortium, and we are a movement to prevent HPV infection and drive action towards the elimination of cervical cancer as a public health concern. Our consortium is made up of over 50 partners from across the world and across sectors who work on policy, implementing programs, and delivering services. And together we focus on engaging across all levels of governance as well as in communities to bring those needs, opportunities, and challenges from the local level to the policymakers. And we're particularly focused on raising the voices of women and adolescents so that we can co-design solutions for their healthy futures. So in this presentation, I'm going to build on what Dr. Aramoke so wonderfully introduced in terms of HPV and cervical cancer, with a bit of information about the impact that they have on adolescents and women around the world to hopefully drive home that really critically important role that nurses and midwives play in advocating for patients to be vaccinated, screened, and connected with treatment. So first, I want to continue setting that stage at the global level and talk about how cervical cancer is the most common cancer in women in 25 countries around the world and the second most common cancer in 58 countries. So when we look at what that translates to in terms of numbers, we've seen this statistic already today, that there are over 600,000 women diagnosed with cervical cancer every year, and 350,000 women do not survive that disease every year. And those numbers are continuing to rise among young women, especially those under 49 years old. So we saw something similar to this on Dr. Aramoke's slides as well, but again, taking this to now the regional level and looking at numbers by region, we can see that Africa, Latin America, and the Caribbean and Asia have the highest rates of both new cases and deaths. And the first thing we can say about this is that there are clearly inequities that exist that make the burden of cervical cancer worse in certain regions compared to others. The second thing I want to point out is that while the incidence rate or the number of new cases over here in orange is 4 times higher in Africa compared to North America, the mortality rate or the rate of women who die from the disease is 8 times higher. And that's pointing out once again that this higher rate of women who are not screened and not treated and not vaccinated their lives are not being saved when they absolutely could be. So this loss is so tragic for so many reasons, but also because cervical cancer is preventable. It's in fact one of the only cancers that can be prevented through vaccination. And even if women are not able to get vaccinated as adolescents, we have high-performance screening tests that can identify the presence of HPV infection or abnormal cells, and treatment options that can eliminate those abnormal cells before they become cancer. Despite this, HPV vaccination rates are lagging behind, where only about 1 in 7 girls that were eligible around the world received the HPV vaccine in 2022, despite the vaccine being incredibly safe and incredibly effective at preventing cervical cancer. And there are over 90% of women in low and middle income countries that are never screened for cervical cancer in their lifetime. So again, these gaps in access, uptake, and acceptance of these preventive services is what leads to some of these disparities that we're seeing in different regions of the world. So that brings us to the question sort of, well, what can we do about it? So there are many reasons that adolescents aren't vaccinated and women aren't screened or treated. But when we think about the role that this group today here can play, it's such an important one. And nurses and midwives that are advocates and champions for HPV and cervical cancer prevention have an enormous impact. So besides, of course, the delivery of services themselves, nurses and midwives play such an important role in building trust around those services, in educating patients or parents around the importance of preventing HPV infection, around educating women about the importance of getting screened, about answering questions that dispel the myths and rumors that exist, and also sharing your knowledge with other health workers to expand this group of champions. So that brings us to our challenge question. So through the Nursing Now Challenge Global Solutions Initiative, there's this opportunity to contribute beyond those areas I just named on the last slide and think about new and innovative ways to decrease those barriers to access and improve the acceptance and demand for these preventive services for HPV and cervical cancer. So for this series, the challenge question is listed here. So it is to create a concept note that crafts a solution to either increase the access, acceptance, or uptake of HPV and cervical cancer prevention services. So that could either be vaccination, that could be screening, or that could be to connect women to early treatment among adolescents and women in your community. And so over the series, you are going to learn more about some of the challenges and barriers that exist when it comes to access, acceptance, and uptake. But we wanted to give a few examples of the types of issues here. And these are also listed in the guidelines document that you can reference as well. But some of those are around overcoming those existing social, logistic, or financial barriers that women face when they're seeking access. It could be around improving the accessibility among difficult to reach or remote communities. So that could be minority or migrant populations. That could be something along the lines of adolescents who are no longer in schools. We also think about integrating HPV vaccination or cervical cancer screening into existing health or non-health services. So maternal newborn child health, HIV/AIDS programs, nutrition programs, mental health programs. How can we make these things more accessible? We think about improving the connection to management and treatment services. So once a woman is screened and she gets positive results from that screening, she needs to be connected to treatment, but that there's often this loss to follow up where women are not connected to the treatment options. So how do we decrease that loss to follow up? Dispelling myths and rumors about vaccines and screening is incredibly important to increase trust and increase acceptance and uptake. There's a multi-generational approach we can take where we educate parents around the importance of vaccination while we're also trying to screen and treat older family members. And then, of course, educating parents, community, and religious leaders. Now, HPV vaccines have not been introduced into the national immunization programs in all countries. So if you happen to be from a country where HPV vaccines are not available in the public health system, there's two options to still participate in this challenge. One, your solution could focus more in the area of improving the access and uptake of screening or treatment if those services are available. Or you can also develop a strategy that would prepare communities for introduction. So before a vaccine is available, we like to make sure that we've built trust in the services that are going to be rolled out. So if they are not available, we can think about making sure that adolescents and parents are excited to have that vaccine once it does become available. And then my last slide here is about the challenge winner. So the selected winner, will select one winner, will be invited to attend our Global HPV Consortium Partners meeting in February of next year. They can present and receive feedback on their innovative ideas from our group of over 50 partners across the globe. They're regional based, they're country based, and they are just wonderful experts across the space. We also are going to do a recording of the presentation, and the winner will have that recording featured on Sabin's and Nursing Now Challenge's YouTube pages, promoted across social media, and will feature the winner on those posts as well. So thank you so much for your time and attention today. We are so excited about this initiative and really hope you'll all participate. We'll continue to post different resources in the Facebook group. And before we log off today, we'll share the mini challenge. But for now, back over to Amy.
Thank you so much, Marissa. It's all sounding so exciting and becoming so real. I'm going to try my very best to play our recording from Aisha now, and if not, we will just continue to move along the agenda here. So I am going to share my screen. And you guys just let me know if you can't hear it.
Hi, my name is Aisha Holloway. I am Professor of Nursing Studies and I have the privilege of being the Programme Director of Nursing Now Challenge. I'm delighted to welcome you all today to this fantastic Global Solutions initiative that we are running in partnership with our wonderful colleagues at the Sabin Vaccine Institute as part of the Global HPV Consortium. This is a public-private movement to prevent human papillomavirus infection, eliminate cervical cancer as a public health concern. And we know if we don't do anything about this, by 2040, we will see an increase in deaths globally of 53%. We also know that nurses and midwives are key to part of this initiative. So I'm delighted and so grateful to our colleagues at the Sabin Vaccine Institute. We have worked with them before and we are working with them again. It's taken a few months for us to put this together, but this is a fantastic opportunity for our network, for our members across 115 countries, all 155,000 of you, across our 6 WHO regions, our nurses, our midwives, our student nurses, our student midwives. Each one of you has the opportunity to take part in this wonderful, I say an opportunity, but probably a career-defining moment, because you'll hear perhaps from some of our previous vaccine champions who have worked with us with Sabin. However, that is enough from me. It's over to our colleagues at the Institute, and it's over to those who have done work like this before, and to yourselves. Take the opportunity, make that leap. Let's see what you can come up with. You have the solutions. Let's hear about them. Take care. Bye.
Amazing. Third time's the charm. Now we've got my personal most exciting part of this whole thing is we're going to hear from my incredible colleagues. So first, we're going to hear from the amazing Harriet Naiga, who is a nurse midwife and founder of Milcot in Uganda. After Harriet, we're going to hear from the incredible Rafayette Akunakan, who is a nurse midwife in Nigeria. And after that, we are going to hear from the amazing Dr. Aramoke, public health nurse from Nigeria. So first, I'll pass it over to the incredible Harriet.
Thank you very much, Amy. And thank you very much for the opportunity to be part of this initiative. I also want to thank the first speaker for giving us the elaborate information about HPV. My name is Harriet Naiga, and I am a midwife from Uganda. I'm also a specialist in sexual reproductive health policy and programming. I am the founder of Midwife-Led Community Transformation, Milcot, which is a community-based organization that brings midwifery services closer to the community through preventive initiatives. I'm also the director of Milcot General Clinic that we are running in partnership with Vaka Health Foundation. I'm really honored to be part of this initiative because the need is really huge to prevent HPV, especially among the marginalized adolescents and young adults whom I work with in my community. Just to give a throwback, the current estimates in Uganda indicate that every year over over 6,900 women are diagnosed with cervical cancer, and over 400 die from the disease every year. And this information was published by the HPV Information Center fact sheet of 2013. So to see over 6,000 women getting diagnosed every year, I think something needs to be done. And also, if we look at the risk factors, especially in my community where I work, we are looking at multiple sexual partners and also at the initiation of sexual activity. These are the women, young women whom I work with and whose lives we are transforming. And what we have done mainly is provision of information about cervical cancer. I really feel that HPV can be prevented, and the biggest buy that we have, the biggest target are the young people. But the challenge we have seen is that there is lack of information among the young people, sensitization. For example, in my community, wherever we go for an outreach, whenever we interface with our adolescents and young adults, we have to ask about their knowledge about cervical cancer. But this is a topic that is ever new into their ears because they think that it's a disease of the older women. It's a disease of the older women, and therefore they do not take an initiative to think about it and also to think about how they can prevent it. So at Milcot General Clinic, And through MILCOT activities, we have really provided sexual reproductive health information and services. And cervical cancer, of course, is never left out. So far, we have reached over 1,500 young girls with the information. And we think that if all stakeholders, if all organizations that interface with the young people really provide information about cervical cancer, I feel that that will be a great move that we shall have taken forward. Also, some research was done previously in 2022 in Kampala, and it indicated that less than 43% of the young girls were receiving the vaccination, complete vaccination, I mean, because when we talk about vaccination, there is also a point of a girl being vaccinated completely, because some tend to get one vaccine and then getting the second is really hard for them. So how do we really interface with the community and sensitize them about complete vaccination? Because we have got the opportunity of free vaccination by the government, it has also extended into the schools. But we have the community where these young people come from. We have parents who need the information. So the more we interface with them with the information, the more young girls will get vaccinated. And also, it is still a challenge in private institutions because it requires resources. It requires resources, and the fact that it is known to be a free service by the public, that means the private institutions need a lot of support to be able to render these services to the community. So at MILCOT General Clinic, with the support of Vaca Health Foundation, this is also something that we are really looking into to support the young people with information. And also we are starting to screen women with for cervical cancer, as well as providing appropriate referrals. So moving forward, what we are set to do is active engagement of the young people. When I talk about active engagement, we want to see active advocacy programs, because a lot of things have been done. A lot of activities have been done on HIV, you know. How about cervical cancer? I want my community to boom cervical cancer, and I want that these activities are really led by the young people. So I feel that the more we shout, the more young people will hear the information, and they will be encouraged to take on the vaccination. So I think I will not really talk much, but our engagement with the young people has really helped us to give information to those we have been able to get in touch with. But there are very many who are not able to even interface with the health workers, perhaps because of many risky factors, including the distance from the healthy facilities, financial constraints, because a lot of people are still living under poverty, and those are the people who are really highly affected. So this is something that we are going to do, and thank you, Nursing Now, for this initiative. I believe that many people will take part so that we save our communities, we save the women, we save the young people from this preventable disease. Thank you very much.
Thank you so much, Harriet. I'm always feeling so inspired and so recharged every time I hear you speak and hear your story. So thank you so much for sharing that with all of us today. And next, I'm going to pass it along to the incredible Rafayette.
Hi, Temi. Thank you so much. It's a pleasure to be here. And hello. I welcome you all to the launch of the new Nursing Now Challenge Global Solutions Initiative with Sabin Vaccine Institute's Global HPV Consortium. My name is Rafia Sakinkum. I am a nurse from Nigeria and an immunization advocacy champion with Nursing Now Challenge and the Sabin Vaccine Institute. And I am here to share my experience. 3 years ago, after completing my morning shift handling immunization clinic of Sabin Vaccine Hospital in Nigeria, I switched my phone on and I saw the call for applications from Nursing Now and Sabin Vaccine Institute, challenging all nurses to share their ideas on how to improve vaccine access and uptake. When I saw this, I was really thrilled and happy to learn that the world recognizes the importance of nurses in improving vaccination and advocacy. And more so, they are willing to listen to us. Personally, to me, the application felt like a long shot because at the time, I was in the rural part of Kwara State, Nigeria, undertaking remarkable work within communities to help them make informed decisions about the importance of vaccines and also debunk misinformation and disinformation about vaccines. I was unsure if my ideas from a community nurse would be competitive enough, but I was accepted and I had the incredible opportunity to become an advocacy champion alongside 7 excellent young nurses globally. During our training, we were empowered to further use our voices as advocates for vaccine uptake. We gathered skills in storytelling to help facilitate this. And slowly, when I entered the communities, I would share stories about how vaccines work. I would also tell these stories in local languages, which helped drastically reduce vaccine hesitancy in my community. So gradually, we saw the impacts of what we were doing. We saw an increase in turnout and acceptance of vaccines. But my work didn't stop there. The role of advocacy, science communication, and community engagement extends far beyond reaching the grassroots. It also involves advocating at the decision-making table and mentoring others while empowering them. In my journey, I evolved from being a young community nurse in Kwara, Nigeria, to sharing a global stage with board leaders and decision makers, including the WHO Director for Health Workforce, the ICN CEO, and various global nursing leaders. And here I am today again, sharing my story and passing the baton of hope to you all, with optimism that you all will become change makers and decision makers wherever you are. The HPV vaccine is essential, with evidence showing it prevents one of the leading cancers and causes of death among women. And we as nurses are closest to the community. And we also possess the power, the knowledge, and the skills to ensure that we improve the uptake of HPV vaccine. If my story resonates with you, or if you feel inspired by my story, I encourage you to apply for the new Nursing Now Challenge and be the change maker and leader you've always wanted to be. Together, let's create narratives and continue to save the lives of beautiful women out there. Thank you.
Thank you so much, Lafayette, for all of your leadership and your incredible work and for passing the baton along, as you said, to our amazing new challengers here. Next, we're going to pass it along to the incredible Dr. Aramoke.
Thank you, Harriet and Rafiat, for your amazing experiences shared. My experience would be a little about the beginning of my experience started with my PhD. So I started my PhD in 2018 at the University of Edinburgh, and my research interest was about vaccination amongst pregnant women. So I conducted my research here in Nigeria amongst pregnant women in a local community. So I can say a semi-urban community. And the data that I got, the information, it was a qualitative study, and the information that I gathered during my data collection opened my mind to what vaccination really is to people. And that began my interest in the area of vaccination. So my study opened my mind to the understanding that vaccination may not be important to people depending on where they're coming from, who they are, their social network, their capacities, because what I found out in my study was that for pregnant women, what was important to them was having a safe delivery and not the idea of complete or consistent vaccination. And I realized that while women were not very particular about them completing their tetanus vaccine, which is what is given to pregnant women, they would give vaccines to their children. So when their babies are born, they don't continue with the tetanus vaccines, but they always go to the centers to vaccinate their children. And that opened my mind to the place of the mother's interest in ensuring the health of their children, even more than their own health. And that was my inspiration when I got home and I realized that Nigeria had launched the single dose HPV vaccine. So a quick background. It was recorded in 2022 that in Nigeria, there were about 12,000 new cases of cervical cancer, and out of which 8,000 people died. And it became a very big concern. So Nigeria, in collaboration with the international bodies, kind of arranged to get the vaccines to the young girls. So when I came, it was in October 2023, Nigeria launched the single dose administration of the Gardasil vaccine. So, but to my surprise, I observed that some people, as opposed to my experience of vaccination during my research, where I noticed that women might not necessarily vaccinate themselves, but vaccinate their children. I expected same energy for them from mothers to their children, to their young girls. But surprisingly, it wasn't the same. So they had different reservations for not vaccinating their children. And what came to mind, and one of the things I observed was most mothers were not they didn't understand, or religiously, the language for the communication of the vaccine was not appropriate to them. So for example, in advocating for the HPV vaccine, like I presented earlier, and from the presentations we had today, we know that this virus is mostly contracted sexually. And that's the basis for which we campaign these vaccines. However, this language I noticed that didn't go well with these mothers. So their responses were like, the responses they gave to me was that from my preliminary conversations with mothers, their reasons were that if you are giving this vaccine to my children, to my daughter, to protect her from an infection that is going to be sexually contracted, then that is against they feel like it's against their belief, their values, claiming that they believe that their own children or their daughter will not be exposed sexually early in life. So they think that telling them that the vaccine is going to protect their children from sexually transmitted disease was wrong, because they did not expect that their daughters will be exposed early on. And that was a concern for me, and I found that very interesting. And that's one reason why I thought to participate in this concept note, to actually propose some possible interventions that can help, especially in a place where there is low resources. And another question that comes to mind is, in communities where there are no resources, what is that creative way to make them reason with us and, embrace and accept these vaccines? Because it is one thing for the government to make these vaccines available, and it's another thing for mothers to accept it for their daughters. So what I observed during that period of the free vaccination was that there was a lot of waste. Most mothers did not agree to vaccinating their children, and some of the concerns were their values, their religious beliefs. And I think that we can find more creative ways to offer vaccination, to give vaccination information and education to mothers, and as well to their children. So I hope that we would also embrace and come along in this challenge, so we can make a difference in our individual communities. So thank you very much for listening.
Thank you so much, Dr. Aramoke, for sharing your viewpoints and your stories. You really nailed in the purpose of this challenge, and I'm really, really excited to hear about all of the incredible applicants. In the interest of time, we are going to have the amazing Hannah and Faye just share the details of the challenge within the chat box. And I'm going to pass it over to Marissa for any questions that you guys might have. And if not, we'll have Marissa close us out for the day.
It was wonderful to hear all these stories and experiences from the nurses and midwives. So I'm inspired, and I hope everyone else is as well. Happy to answer any questions about the challenge itself, or if there are any questions about HPV or cervical cancer, I definitely defer to the expert nurses on the call. But please, any questions, do let us know. And you can either place those in the chat or unmute and ask your questions verbally on the call. While we're waiting for any questions, I will share that in the Facebook group, we are going to share a number of different resources that can be useful both in your day-to-day work, but also in developing your concept note. One thing we do ask is for there to be a brief section in the write-up about what the current status of HPV or cervical cancer is in your country. So if those are things that you are not sure of the current coverage rates or what's been introduced or not introduced, we can share a few resources that can help you build out that section. And I don't know if I see any questions in the chat, but if you have questions, once you get a chance to review the guidelines, place them in the Facebook group and we can also answer them there. In the meantime, let me share my screen one more time just to present our challenge, our mini challenge question. So sharing that now. So we like to get the group a little bit engaged on the Facebook group to kick us off. So as part of the first mini challenge, let us know what you most hope to learn from this series on HPV and cervical cancer. We have 2 more sessions after this, and if there's a way we can tailor that to things that you really want to learn about and information you want to receive, we'd love to hear that. And then why is this topic important to you? What motivated you to join today? What is it about HPV and cervical cancer that is such an important topic for you, and what do you want to learn more about it? So again, post those responses in the Facebook group and we would love to review them. We'll also share some resources there for you all and answer any questions that you have on the challenge. But with that, I can probably hand it back over to Amy and the Nursing Now team.
Amazing. Thank you so much, Marissa. Thank you so much to everybody who joined us today and to our incredible esteemed speakers. I'm sure everybody here would agree with me that the impact that nurses have on this cause and on all the causes shared throughout Nursing Now is just truly immeasurable. And we really look forward to hearing from you all and seeing your applications. So thank you so much for joining us and have a great day.